raise your hand. We'll bring a mic to you.
Is this on? Oh, Dr. Mikhael, is there a fast track email or phone number if we were interested in being in a clinical trial at Mayo? Because I've been on your website and it's a maze of trying to get to multiple myeloma. I haven't really figured it out yet. So.
Yeah, sorry. I think you need like a calculus degree to. We're actually. I mean, your question is well placed because we're in the midst of. And I'm in the middle of it. We're changing the way that people are going to be able to access the website. The simplest thing to do is to just call any of the phone numbers you see on any website for Mayo Clinic Arizona, and we actually have a dedicated phone line for people interested in clinical trials, so they'll be able to patch you through. And then what happens is they gain some information from you, and then actually I personally now screen all of our consults for the myeloma program. So it ultimately comes to me at some point, and then we can determine people's candidacy around a clinical trial. And then furthermore, we can then fast track people's appointments. We have a commitment from the four of us that exclusively are doing myeloma, that if patients are coming, particularly for clinical trial, but frankly for anything, if there's an urgency to the case whatsoever, then we see people urgently. So that's probably the simplest way. We can chat after too. I can give you more specifics. Pleasure.
Have any of you discovered a genetic component or cause for multiple myeloma? I'm familiar with a family with 2 cousins and an aunt that all have it, with these pathways and targeting and different chromosomes. Does anyone know?
There actually is some evidence. So I always want to be careful how I answer that question, because this is probably the most common question I get at patient Q&As. So again, I didn't pay for that question. I didn't insert it. But it's very common because people naturally think about it, because we know there's certain kinds of breast cancer in particular, certain kinds of colon cancer that genuinely run through families. So the party line with myeloma is that this is not, generally speaking, a familial condition, and that's true. And the studies that many here on the panel and in other places have done have borne that out. However, there have clearly been clusters of families that we have found worldwide where that has been the case. In fact, before I came here, when I was in Canada, I had an interest in this, and we tried to poll all the patients that we knew of across the country, and we identified a few families, and we're doing genetic studies on those families where, like you mentioned, there's more than one person that seemed to have. I had myself a patient who had multiple myeloma, and he had both of his maternal aunts had multiple myeloma, clearly documented. So there's clearly situations where that runs in the family. Now the question is, of course, is it really that you pass on the myeloma, or is it that you have a genetic profile that puts you more at risk of developing myeloma? Because one of the things we've learned about myeloma, as well as just about any other malignancy and many diseases, frankly, even beyond malignancy, is this is a combination of a lot of things. Your own genetics, whatever, maybe environmental exposure that we have, chance, whatever else you want to call it, all of those things sort of meld together to result in any person given myeloma. So there might be a certain set of genes that people have that put them at greater risk of developing multiple myeloma. That being said, when we look at the huge number, sadly, of people that have myeloma, but when we look at that greater population, the number of people that have any family relative that has myeloma or related condition is extremely small, well below 1%. So it's not that every time I see a patient with myeloma, do I start testing everybody in the family. The right approach is to take a history and find out if there are things, and if, when there are family situations like that, we try to see with the family's consent if we can obtain blood samples at least to try and learn a little bit more about it to make that connection. But so far we've not genuinely identified a familial form of myeloma. There have been some labs that have talked about those common features that they found, in particular one of the labs that we collaborate with at times in Arkansas that have written actually fairly recently, just last year in the New England Journal of Medicine, published a paper regarding this concept of familial myeloma, but it's still in its early phases of understanding.
Yeah, I agree. The heritability factor for myeloma is fairly low compared to cancers like prostate cancer, breast cancer, colon cancer, is one person who, really is moving, in this field. His name is Henry Lynch. I think it's Lynch. And, it'd be interesting, if you want to, find out as much about hereditary multiple myeloma, he's probably, the world's foremost expert in that area. But we are moving forward. I'm actually trying to propose a study to try to identify those common genetic risk factors that, so it's not necessarily a familial thing, but are there inherited risk factors that might be common in the general population, but when combined with other, environmental factors or even other genetic lesions, make a person, have a higher risk of being diagnosed or, so, we're still moving in that area in myeloma, but I agree it's not highly heritable. There are familial cases, and hopefully within the next 4 or 5 years, we'll have a lot more information on the inherited risk factors that might influence myeloma risk.
You haven't seen necessarily a familiar inheritance, but what is the percentage of people that have myeloma that you've seen that have had other cancers first and then developed myeloma? Is that a large number?
So actually, there's a fair amount of work in that field in particular, trying to identify, again, this whole. So let me step back for a second. The whole concept of people having more than one cancer has been a field of great study of late, and there's all sorts of theories about it. So the theories include, number one, if someone has some kind of genetic, I hate to use the word weakness because that's not the right word, but some genetic predisposition to potentially get a cancer, then maybe they have a predisposition to get a second cancer, number one. Number two, the other potential mechanism is cancer patients get watched more closely than other people. So they're getting screened more carefully, they're getting watched, and the so-called incidentaloma, where incidentally we find this other cancer, so the risk is higher. Number three, there are treatments that we give for certain cancers that can, we know by virtue of that treatment, put people at risk of cancers later. Pediatric situations, children, for example, that although we don't do this as much anymore, there's sometimes situations where we have to, where historically a lot of pediatric cancers were treated with a significant amount of radiation or certain kinds of chemotherapy agents that we know put people at risk for leukemia and even myeloma and other conditions. Fourthly, is there a common link between now trying and drill it down to your question about myeloma, those are the sort of the three broad categories for cancer in general, focusing on myeloma, saying, well, are there